Hello there, Robert Nardis here from GEMt International. Thank you for tuning into this month's podcast. Again, we've searched far and wide to bring exciting people to you and interesting topics to the table. People who can think outside the treatment cubicle and make the most of their profession. And hopefully it inspires you, and hopefully you enjoy this month's edition of the GEMt podcast.
Thank you for coming for Beyond the Bones. As a chiropractor, we're always trying to learn something that is beyond our normal discipline of practice so we can serve our patient a bit better. So today I have Rob will come in to show he was my 老师 who taught me three years ago, dry needling 3 years ago. And he has been physical therapist for 35 years. So yeah, for the last 6 years, Rob has been traveling to Singapore twice per year to teaching us that. So another question I want to ask you is, in regarding of acceptance of dry needling, the treatments, culturally, any difference compared to Australian patients or the Singapore patients?
Yeah, good question. So I obviously haven't treated patients in Singapore. I only instruct delegates and they do it, but their feedback and the general consensus is in Southeast Asia, because you have closer links to techniques such as acupuncture, it's very well accepted. So people think they have an understanding of it. Because more people are exposed to acupuncture, they get it a little bit confused, but because there is similarities in the techniques, it's actually better understood and better accepted in Southeast Asia. Having said that, it's becoming incredibly popular in Australia and New Zealand as well. But traditionally, there's not been an issue introducing it into Southeast Asia or Singapore.
So this is a question a lot of my patients also ask. What is the difference between acupuncture and dry needling?
It's not an easy thing to explain to a patient, but I get asked that question, and I have two different answers. One's for health professionals and one for patients. But often when I'm introducing dry needling and they say, "What's that?" I will say, "Have you ever had acupuncture?" Because 10% of the population have had acupuncture. And even though only 10% have had it, many of them think they know what it is. And I say, look, we do use a similar needle, but we use it very differently. In acupuncture, they leave the needles in, and they're aiming to stimulate energy pathways in the body. Whereas dry needling relies on the expertise of palpation by the therapist to actually find a trigger point, which is a tight knot within a muscle. And we're going to put the needle into that trigger point. We're not going to leave it in. And we're going to get a response out of that trigger point called a twitch response. So the muscle will twitch. I like to call it a little dance on the end of the needle. The whole procedure will be done in 10 or 12 seconds. So it's even though it may look similar on the outside, it's actually very different clinical application of the use of this dry needle.
So in regarding of a dry needling technique, is there a different type of school of thoughts or style?
Yes. Look, there are several styles, if you like, and I have to admit GEMt has taken the best out of all styles and put it together with my own experience to come up with our own methodology. One of the issues is, Jenny, many of the people teaching dry needling are acupuncturists, and so they're combining it. Now, there's many definitions of acupuncture. One of them is leaving needles in for a long period of time, whereas our model is very different to that. We never leave needles in. We're getting an immediate response and an immediate impact with the needle that goes in. We get the job done and we get out of there. Different people have slightly different approaches. Look, on my courses, you might think I'm biased, but I tell them I've tried all the approaches, and if I'd found a technique that was more effective, I'd teach it. But the technique we use to dampen down the twitch response, certainly for me, gets the best clinical results that I've found.
Some of my patients, their feedback is dry needling is super effective. In fact, we can see almost immediate results in regarding a range of movements, flexibilities right away. But the feedback is is a bit uncomfortable, and some of them feel like it's very, very painful. So why is that so? Or is there any way can improve?
Look, everyone responds different, like any modality. It wouldn't matter if it was ultrasound manipulation or mobilization or massage. Everybody responds differently, and everyone's receptors are unique to their own experiences. And you're absolutely right. There are some people that it's almost like a minor miracle with a needle, and others find it far more uncomfortable. It really comes down to so many different systems in their body and how they're interpreting that signal. And those who've been in chronic pain are usually more sensitized. So we certainly modify the technique for them. And on our programs, you would have seen us use the stimulator.
Yep.
The stimulator is a really nice way of introducing those that are a bit sensitive and that may not like the twitch response approach. So we always use the stimulator. I run a clinic in town called the Melbourne Whiplash Centre. And our whippers, as we affectionately call them, they're very sensitised. They're afraid. They're in a lot of pain avoidance. And we often use the stimulator with them, which is a nice way to introduce them to needling. You can still have a clinical impact. And certainly the technique is nowhere near as uncomfortable.
So what do you see about, future application of dry needling? As you know, like technology is always evolving, and a lot of treatments, you're trying to implementing some kind of AI with that. So for dry needling, how is it going to adapt or catch up with technology?
That's an interesting question. I don't know how AI and manual therapy can be involved in the same sentence. Okay. Hopefully I'll be around long enough to be proven correct, but I don't see a role for AI in being able to find a trigger point in the human body. I'm happy to be proven wrong. Those who attend my courses know I'm a traditional manual therapist, and I'm positive and I'm optimistic that manual therapy will make its comeback in society. AI will probably eradicate a lot of exercise-based practitioners in this world, because it certainly can dish out exercises in a far more efficient manner than many therapists. No offence to exercise-based physios out there. Dry needling involves two of the most essential skills that we have. And that is, we are knowledge brokers. We know more about the human body than the people we're treating. We have a professional license to touch and feel. And I don't know how AI is going to replace my ability to palpate something in the human body that isn't right.
I guess after a while, we will still have a job. After all this.
Manual therapists will always have a role in the health profession, without a doubt.
So 35 years practicing dry needling, you must have some remarkable or memorable case. Would you like to share a few? Well,
look, I've got many on both sides of the ledger. When I was a young therapist, I certainly made a few mistakes with a needle in my hand. One was a sprinter who could run 10.6. He had a straight leg raise of 50 degrees, came in with tight hamstrings. Didn't matter where I put a needle in him, he improved 10 degrees. And his straight leg raise, he left there touching his toes. We both thought we were heroes. He went out and raced the following weekend. He went from 10.6 to 11.4 because I'd given him way too much range of motion in one consultation. We got him from 50 degrees straight leg raise to 85. He didn't have a motor pattern for it. I'd got rid of all his elastic recoil. It was one of my silliest things I ever did in a consult. But that story's 20 odd years old, and we've learned from that. Look, dry needling, my expertise with the dry needle has enabled me to travel the world. So running courses in the US, Southeast Asia, Australia, New Zealand. So anyone who challenges us to say dry needling doesn't work, then not all my patients can be silly. They come back to me because they're getting results. And we've not just changed the lives, Jenny, of patients around the world. We've changed the lives of practitioners. I was at a conference last year and a man came up to me and he said, "Robert, you're probably not going to remember me. I did your course 5 years ago. I'm now known as the needler in town. My whole practice has changed. I've just bought a family home in Sydney. And if it wasn't for you, we would never have the lifestyle that I have." Okay? Because he's making a difference in people's lives. And when people stop me in the street to thank me for teaching them this skill, it just makes me happy to the core, I got to say.
I mean, I took your course 3 years ago, And I remember after that weekend and the following week, I was, ready to introduce to my patients. I mean, obviously, I myself have a hesitation, be like, because I just learned this over the weekend, and like I'm sharing with patients, like, would you like to try that? So in my mind, I do have some doubt, like, I practice, but I want to see whether or not you really can make a difference. And very, very proud to say so far we have very high successful rate. Maybe one or two cases we just never really get a result. Things happen, nothing is 100%. Yeah, but most of the patients has got a great result from that. And as you know, Singapore is facing a huge aging population, probably similar to many places in the world. So for the elderly patients, if any manual therapists, rehab specialist, chiropractic physio are watching this, how can they use dry needling to improve the life quality or outcome of the aging patients?
Yeah, good. Look, if I turn the clock back, I never used it on the elderly. Because I know it's uncomfortable. And there was this classic story that I was treating this lovely grandmother, and she'd always wait for me because every time she hurt her shoulder, she'd come and see me a couple of times a year for 2 or 3 consults. Anyway, she had to wait to see me once, and she said, "Oh, where were you? And where did you have a holiday?" I said, "No, I was overseas teaching." "What were you teaching?" I said, "Dry needling." And this lady's like 82, and she said, "What's dry needling?" And I kind of said, "Oh, it's a fast and effective way to have an impact on muscular problems." And she said, "Then how come you've never used it on me?" Now, my answer was in my head, because you're a beautiful old lady, you remind me of my grandmother, you bake me cookies, it's a bit uncomfortable, I don't want to hurt you. And I thought, I can't say all that. And I said, well, okay, we can try it. Anyway, so I needled her shoulder, did some rotator cuff work, and she goes and gets full range of motion in front of me. Now, normally we wouldn't achieve anything like that. Now her voice changes and her tone changes and said, well, Sonny, why haven't you done this before? Right? Now, the elderly, their receptors aren't quite as sensitive, and they actually don't feel, I don't think they feel pain as much as my younger population. So age is no limit to needling at the top end. It is at the bottom end, but not at the top end. So I have no hesitations needling the elderly. If their range of movement problem, if their pain is due to a muscular condition, they can respond well to dry needling. So don't be hesitant when you see someone's date of birth, unless they're under 16 years of age. That's when you should be hesitant. It's at the other end that you could be cautious, not the older age.
What about for patients who has certain chronic conditions, such as dementia, Parkinson's, muscular issues? Would dry needling still suitable for them?
It's a good point. There is actually some exciting and emerging research coming out with the use of dry needling with people with neurological conditions. Last year, we went to Indonesia to teach 20 neurologists how to use GEMt dry needling in an adapted form with stroke patients. So very pleased to say we've got neurologists, and they've invited us back later this year as well. And so we use a modified technique, and I actually introduced 3 modifications of our approach to have an impact with stroke patients. And the answer to the question, Jenny, is it's individual. So as a qualified practitioner, we have the ability to assess, provide an intervention, and then reassess. And intuitively and objectively, you will find whether the treatment's being effective or not. So it does have an impact on muscle tone, at least for a period of time. And in that period of time, and it varies with people, you have an opportunity to get them to do some functional rehab. And as you know, particularly with a stroke patient, the first stage of reinstalling a motor pattern is they have to see themselves doing something. Why they use mirror boxes. And if we can alter tone for a period of time and have a stroke patient grab a cup and give themselves a drink of water, you start the recovery process. So it certainly can be used with neurological patients. There's some good and emerging research. I can send it to you on Parkinson's disease as well, where a cohort did respond, at least in the short term, to dry needling to alter spasticity.
So do you see that dry needling perhaps one day can be implementing as a part of an essential rehab program in regarding, maybe post-surgery, post-stroke patients, and even like a mandatory protocol for recovery?
Look, I'm a little bit biased only because of the results I get on the end of a needle, but I would love it to be one of the modalities that should be tried in many conditions that involve muscles and tendons, and whether it's from a neurological cause or a sporting injury, it should be one. It's not a panacea. It's not the elixir of life, but many people respond remarkably to dry needling. And so following any trauma, and surgery is a trauma, a stroke is a trauma. Do you know what I mean? Everyone knows a sprained ankle is a trauma and a motor vehicle accident is a trauma, but so is surgery. And without a doubt, it should be considered in the right hands for the right patient. And again, assess, provide an intervention, have objective markers, ask your patient and reassess. The experts are in the room. All you need is the patient and the therapist, right? And between the two of them, they can work out whether that intervention's been effective.
Yeah. So, like, how did you know about dry needling? How do you start as a practitioner in dry needling and now become a lecturer on dry needling?
Yeah, I was in the United States lecturing on whiplash. And this is, I don't know, 25, 30 years ago. And I was telling one of the delegates that when I read on a plane, I get a headache. And this gentleman's name's Ado Zolstra. And the next thing I knew, he said to me, do you mind if I dry needle your neck? So I'm lying down. And at the time I thought, this crazy American, he popped a needle in on my C2. He needled my rectus capitis posterior major. I got a twitch response and my upper cervical spine twitched. I was partly petrified. The next day I jumped on a plane and I read for as long as I wanted to with no headache. And I thought, there's something going on here. So I started to do some courses in Australia. I did, at the time, what was considered the world's best course at iStop in Canada. 2 trips to Canada over a 12-month period, did 2 4-day courses and an advanced course. Very impressed with their program, not so impressed with some of the programs that were going on in other countries, and realised it was being taught very differently, realised there wasn't protocols regarding safety and its application weren't concrete enough for me. And then I just started using it a lot and then combining it with anecdotally looking at what was having an impact, what wasn't, documenting the things that were helping. And then I went about extracting all the safety procedures I could from all the so-called experts in the world. And we've incorporated them all to come up with what I believe to be the safest program. Spending a lot of time under real-time ultrasound, looking at needle insertion points to make sure that they were safe and away from standard neurovascular structures. And that's how our program developed. I just saw a need in the market for a bit more safety to be introduced, a bit more caution, and a bit more clinical adaptation. And so that's why we have a lot of case studies and bring in a lot of my own personal experiences.
I also want to ask you, because you fly to Singapore twice a year for the last 6 years, so 12 times in Singapore. So we want to know, you have taught many therapists, physical therapists, chiropractors, people in other manual therapy discipline. Any culture differences between your Singapore students than your Australian or American students?
Wow, you're probing deep today, Jenny. I love it. So there's many things I love about teaching in Singapore and Southeast Asia, and it's the respect they give educators, and it really impresses me. And I'll just say this: in Australia, when a course finishes, and we get to the end of 2.5 days, and I say, any questions? The average Australian will say, are we going to finish on time today? When I'm in Singapore, it is, can you stay back for some more questions? Can you stay back for a selfie? Can you stay back for be on my Instagram? Can you give me an autograph? They're just incredibly respectful as a society and culturally. And that's one of many reasons why I love coming to Singapore.
So what do you see future of Singapore, therapists using dry needling? Do you have a plan for us in this part of the world?
Well, we have I've got a very good team over there led by Gareth and Bala. They're our regional managers, and their team that we've trained up, they run our level 1 courses. So I just come in twice a year to run the advanced courses. But Bala and Gareth head up a very strong team over there. Some of our most experienced needlers are certainly in Singapore. So we love teaching there. As I said, I come in and run the advanced stuff. And so we're just going to continue with that. We're proud to say more practitioners in Singapore have been trained in GEMT style needling than any other approach. And the great thing is patients are starting to ask for it as well. They're not just asking, are you a needler? They're asking, are you a GEMT needler? And that makes me incredibly proud that my goal was, whether I'm teaching how to needle a muscle in Melbourne, Sydney, New Zealand, New York, or Bala and Gareth are teaching it in Singapore, the procedure will look identical. And that's what we've been able to achieve. We've been able to produce something that is very reproducible, very safe, with maximum clinical impact. And that's what I'm proudest of. And that will be hopefully GEMT's legacy, that we're able to roll it out internationally with a program that just has that clinical impact.
Some of the viewers watching us probably, they are practitioner in the discipline maybe for 5, 10 years. You know, as a practitioners, sometimes the work can be a bit mundane because we do a lot of times beside practitioner, we're also business owners. There's multiple roles we have to. So you've been in the industry for 35 years. Any tips for practitioners / business owner to face this uncertain times, you know, when it comes managing patient outcome and a business outcome?
Look, this is, we could talk about this all day. You're absolutely right. One of the things that motivated me, I ran my own clinic for 32 years. And over that time, I saw a lot of practitioners lost the profession because we're skilled labourers. That's what we are. We're skilled labourers. And most of us think we can only earn an income with our knowledge by being in the room with a patient at the same time. And so as a business owner, I made sure that our crew had plenty of options and plenty of variety. One of the things we introduced, like all our staff get trained on dry needling because it's far less physically demanding. Not only, well, for me, I get superior outcomes by using needling with far less energy in a shorter period of time. So it ticks all the boxes. Better outcomes, doesn't hurt my wrists and my thumbs. Patients love it more because they're in and out and we save everybody time. But giving your staff options and making sure as a business owner you have options as well. Understanding that we're knowledge brokers. You don't always have to be working up a sweat in a cubicle, but always looking for opportunities in the environment. So, you know, we opened up an ergonomics company as well. And so many of my staff could go out and provide ergonomic advice in the workplace, which didn't involve anything physical other than showing someone how to adjust their monitor or adjust their chair. So look, I do business coaching for a reason, is to pass on that experiences, because so many people get disillusioned. Many business owners in our health, they end up just giving themselves a job. That's all they're doing. They're not actually, there's got to be advantages in being a business owner and working 60 hours a week and paying yourself a salary. That's not what being a business owner is. That's just buying yourself a job, which is not what it's about. You won't last long in the profession. I could talk more about it, but it'll take up your entire podcast time.
Yeah. So maybe before we turn off, any last of maybe word of encouragement or insight or wisdom you can pass on to, you know, fellow practitioners who not only, I think I really like when you talk about business aspect. I think most of us are listening is, you know, we have passion for patients, but sometimes running a business is slowly taking that passion away. So, you know, just maybe some word of advice or maybe encouragements for the fellow business owners / practitioners.
Yeah. I'm going to say this, look after yourself, okay? If you ask every practitioner, why'd you get into this line of work? It's because I want to help people. So if you're not at your best, you can't help those people, okay? And too many people fill up the appointment book, lock out their lunch breaks. Look after yourself for the long term. Every morning when you wake up, just be grateful that you've taken in a breath of air. You've got another day to be a better person. You've got another day and another opportunity to make a difference in someone's life. Got to remember, the person you're treating had options, but they chose you to make a difference in their life. That's a huge responsibility. Sometimes we lose track of that. They chose you to make a difference in their life. They chose you to mold their future health. So it's a huge responsibility, and make sure you're mentally recharging yourself to face that responsibility day in, day out. Look after yourself as a practitioner.
Oh, that's very, very good. You should share that more during the next seminar. I think the students will be very much appreciated. The word of wisdoms, when it comes to real practice and real day-to-day grinds. And I think that sometimes even myself, keep forgetting about that, especially you are living in Singapore that is high inflation, everything is quite expensive. You sometimes can let number to carry it away. So thank you so much, Rob, for your time. I really appreciate the conversations. And for anyone who want to know more about GEMt, I would definitely link the description in the description box, so you can totally check it out. I have a ton of course 3 years ago. It has benefited me tremendously. And, just something that I offer to my patient together with chiropractic and getting just great results. So thank you for your time. And for the viewer, also thank you for your time. As always, I will see you next time. Bye-bye.
Well, thank you for joining me and listening to our GEMt podcast of the month. I trust you found it insightful, and hopefully you enjoyed it as much as I enjoyed being part of the interview process. Members get access to all our podcasts and playbacks, plus so many other features on our membership site. So if you'd like to be a member, by all means contact us. Thank you again for being part of GEMt International and supporting us, and I look forward to joining you on our next episode of GEMt Podcast.